The Ohio Nursing Association believes there's a direct correlation between nurses getting tired from working overtime and medical errors, including death. The ONA is now asking lawmakers to make it illegal for hospitals to mandate overtime.
First News reporter Molly Reed looked into the condition for local nurses. She's live in the studio.
There's currently 18 states where it's illegal for nurses to work more than 12-hour periods in a 24-hour period. But Ohio's not one of them. According to a study from a national nursing database that breaks down practices and medical errors, 43% of the errors came from registered nurses. A nurse I talked to today said that's directly tied to fatigue from overtime. In the hospital, nursing can be a taxing job, both physically and mentally.
When you go in and you go through your shift, be it an 8-hour shift, which was what I always preferred, or a 12-hour shift, you need to be able to go home.
But rarely is that the case. Carol Smith has been a nurse in both Youngstown and Cleveland hospitals for 36 years. She says the mandatory overtime nurses are required to work is dangerous for them and the patients.
Calculating dosages of very significant medications that keep us alive. It would increase the potential for error. There's just no way around that.
The Ohio Nurses Association said it surveyed 170,000 of its members. Of those people, 35% or 21,000 of them said they're too afraid to speak up about overtime for fear of losing their license or getting harassed at work.
That was just known. When you refuse overtime, you can be fired.
The ONA is pushing for lawmakers to make mandatory overtime illegal. WKBN asked Don Koenig, Chief Operating Officer for Mercy Health, what this would mean for hospitals and its staff scheduling.
I can understand the need to try to do it, but it is just one of those very difficult balancing acts for hospital administrators to hit that right balance every day, every shift.
The Ohio Hospitals Association has said it is opposed to this, saying staffing constantly changes based on the number of patients. It says mandating staffing ratios would restrict the hospital's ability to adjust to the needs of its patients and also assumes all of the nurses share the same skill level. In the studio, Molly Reed, WKBN 27 First News at 6.